Hi everyone, thank you so much for the reception for the previous video, and I'm glad it was able to bring to light a couple of issues, and I hope that it really helped. I'm making this video to talk about the second vaccine available in our country, in Kenya. That is a Sputnik V vaccine. This is a vaccine that is from Russia. It's a viral vector vaccine, right? This just means that it triggers the body. How it works is that it triggers the body to produce proteins that are similar to the coronavirus, and these proteins, once produced, will again stimulate production of antibodies. These antibodies will fight against corona in the event of exposure to corona, all right, and so will prevent either symptomatic infection, be it mild or severe infection. The Sputnik V vaccine was developed, or the development of the vaccine started in May of 2020, and in August they allowed it was approved for use in Russia, which raised eyebrows because you cannot allow a vaccine to be used that early. However, in February of this year, the phase 3 trials interim results were released. The trial essentially involved around 20,000 participants who were placed in two groups. One group received the vaccine, and the other group did not receive the vaccine. In the group that received the vaccine, by the time they were getting the second dose, that is 21 days post first dose, 91% did not have COVID, and 9% had COVID, as opposed to the control group, which is a group that did not receive the vaccine. So in this case, they released those early results, and that's what allowed it to even be used in other countries. As of now, more than 1 billion doses have been ordered all over the world, Kenya being one of them. However, in Kenya, it's not being purchased by the government. It's by private individuals who, through the Pharmacy and Poisons Board, received emergency use authorization. That is essentially only used whenever there's an emergency, something like a pandemic, and it is and so it is actually sold. Okay, you will not get it for free. It's not like the AstraZeneca vaccine. It goes for 5,500 a dose, and you require 2 doses. All right, 2 doses, just like the AstraZeneca vaccine, but in this case it is only 21 days apart. Okay, so you get the first dose today, 21 days from now you get the second one. It is still administered at the same site as AstraZeneca and any other vaccine, at the deltoid area, that is the outer aspect of your arm, all right, and the arm that you don't predominantly use, your non-dominant arm. In terms of who can or cannot use the vaccine, the contraindications are almost similar to the AstraZeneca vaccine. Anyone who's had an allergic reaction to the first vaccine can absolutely not receive the second one. So we can only know if you have reacted to the first one. So if you're someone who has allergies, please, after receiving the vaccine, don't leave the hospital. Stay there for 30 minutes so that if you do get an anaphylactic reaction, they can be we can promptly detect that and be able to treat you. All right. It's for the other groups, such as pregnancy, of women who are pregnant, breastfeeding. Again, no studies on that. For people below the age of 18, they were not included in the study, so it is also not to be used in individuals below the age of 18. For any other conditions, you'd have to really talk to your physician, but remember, issues such as hypertension or diabetes predispose someone to heart disease, predispose you to severe COVID. All right, so essentially these are beneficial to you. If you have other issues such as immune compromised state, cancer, issues with your blood, maybe severe anemia, you need to talk to your physician, because these are the groups that are not included in that particular study. And the phase 3 trials is still ongoing. All right, those are just early results, still ongoing, so we can't talk so much on it, unlike the others that sort of were not released too early. But this is based on what they basically told us. The side effects from that group, the 20,000, the ones who received the vaccine, about 14,000, 94% of them had side effects, but the side effects were the mild ones, okay? By mild, I mean local reactions such as swelling at the site of injection, headache, body pains, chills, fever, that all resolved and responded to simple pain medication like paracetamol, diclofenac, brufen, and there were no adverse events, okay? There are no severe complications that at least they told us about. Remember, this is all coming from Russia. It is only now that that it's actually being studied in Europe. Okay, it's now that they are following on people who've received the vaccine to see did the information they gave us, does it correlate with what is actually happening? So as we go on, we'll get more information on any other potential side effects. But as of now, what they have said from Moscow is that only 94% had side effects, and they were very mild side effects. In that particular group of 14,000 who received the vaccine, 4 people died, but of unrelated causes, so no deaths, okay? No deaths were noted that were related to the vaccine at all. All right. So currently the vaccine, as I said, goes for 5,500. So be ready to fork 11,000 for it. You, however, will not have to wait in the queue, because remember, we are rolling out the AstraZeneca vaccine in phases. So for some people, they may feel like, oh, by the time it gets to me, it'll take so long. So in that case, you may contact those particular suppliers. I believe their contacts are on the internet probably. Or facilities that have the vaccine and are administering it. Okay, so continue keeping safe, taking care of yourself, and I'll come back to you guys with another video on all things COVID. Right, keep safe. Thank you.